Well, welcome back from the break. And we are in the home stretch of our 2 days together. And leading today's closing session is our two important speakers that I have the pleasure of moderating a conversation with, including Katie Keith from the White House Gender Policy Council and the Surgeon General of California, Dr. Diana Ramos. I invite you both to the main stage. Hello to both of you. I'd like to introduce you a bit further. I wanted to share that Katie Keith serves as the Deputy Assistant to the President and the Deputy Director of the White House Gender Policy Council, where she oversees the council's domestic policy portfolio, including issues related to health, economic security, and education, particularly of women and girls. Katie Keith is also on leave right now from the Georgetown University, where she served as an associate research professor at the Center on Health Insurance Reforms and the Director of Health Policy and Law, again, at the Law Center's O'Neill Institute. I'm very excited to have you, Katie, and really excited about your expertise in all things health policy, in addition to serving women and children through the Gender Policy Council. And next, I wanted to introduce Dr. Diana Ramos, who's been a colleague and a friend of the Policy Centers for quite some time. The very first time that we addressed adverse childhood experiences at the forum, Diana was in the audience and also has presented some of the very first work on maternal suicide for the country at our forum. And so, Diana, it's really a pleasure to have you on our main stage. Let me share with our audience just a little bit more about your background. She is an OBGYN and also California's second Surgeon General, and has experiences working on various issues in women's health, but also adverse childhood experiences, which we had an opportunity to talk quite a bit about today, starting in our earlier panels, and a story from a mother, which was shared earlier today. Dr. Diana Ramos is a public health leader in California and beyond. She's a leading spokesperson on all things public health here in California, where I'm based, but also serves on various state and national committees and bodies, including the California Maternal Care Quality Collaborative, which is a collaborative that has implemented many maternal safety toolkits and bundles that the rest of the country and the world have taken note of, and also the Federal Women's Preventive Services Task Force. Her mission is to advance health and well-being of all Californians, and she's dedicated to equity. It's a pleasure to have you both here. I'm so excited. I would love to start with you, Dr. Ramos. I would love for you to start a little bit about, share your passion for health equity, and where does that come from, and what's keeping you up at night relative to health equity?
Thank you so much for the invitation to be here, Joy, and for the continued partnership throughout the years. So why am I so passionate for equity? I think we just need to start and look at the people around us. And I can say personally, here in California, it's the 40% of the people in California which are Hispanic descent. And as a Latina, having come from the low socioeconomic status and really faced many adversities, I know personally and have cared for many patients professionally, the importance to really weave in equity, not only in education, but healthcare, and to realize that the data speaks volumes, that we really need to do a lot more work to improve not only the disparities in maternal death in the Black population, but understand also the historical impact that racism, that historical experiences play into our health. So highlighting the past, but more importantly, working with all of you, and I've been so inspired by hearing many of the presentations. I believe all of us together are on the right path to really addressing the equity issues. You mentioned the adverse childhood experiences, and I really want to bring that up because I see that as one of the opportunities to really improve equity for everyone across the lifespan. And what do I mean by that? Because of the fact that if we address those adverse childhood experiences that we have as children, if we address them before age 18, there is a 44% decrease in health disorders, 44%. So we wouldn't even have to be highlighting the information on how do we treat, what are the, resources available. We would have already prevented it. So this is an upstream opportunity that we can all implement. California is leading the way in addressing adverse childhood experiences. I love the presentations that were shared earlier, but imagine if we can decrease maternal mental health by 44%, and more importantly, the data shows that there is an increased association with preterm labor, preterm birth, miscarriages, low birth weight with people who have 4 or more adverse childhood experiences. Wow. Let's start with the beginning. Let's start with that upstream opportunity. And unfortunately, not everyone is impacted by ACEs equally. We know that if you are of low socioeconomic status, LGBTQ+ background, Hispanic, Black, you are disproportionately at higher risk for having higher ACEs. But knowing that information is an opportunity for us to proactively address and support the work that is needed to be done to address the adverse childhood experiences. So that's why I'm excited, and I'm really thrilled and honored to be leading California in this ACEs work and really the reproductive health, maternal health space.
Thank you, Diana. It'll be good to unpack some of the policy strategies we might be thinking around mitigating those adverse childhood experiences before the age of 18. We'll come back to that here in a minute. Katie, I want to turn to you to tell us a little bit about what is the White House Gender Policy Council, and give us some examples of your work. I know some of us have been following some of it that has caught a lot of attention recently around research. So hoping you can talk about that, of course.
No, absolutely. And Joy, thank you for all of your leadership, for having us here today. And it just seems like it's been such a terrific conference already. So thank you for the opportunity, I think, to even take a higher level view and talk a little bit about the Gender Policy Council. So for folks who are not familiar, we have never done this before. An administration has never created a Gender Policy Council, at least not at the federal level. And so this was the president's vision. He created the White House Gender Policy Council in March of 2021 and charged us with really advancing gender equity and equality across everything the administration does, both domestic and foreign policy. Joy, as you mentioned, I'm responsible for coordinating our domestic policy portfolio, and so lead that work sort of across the White House, but then also across all the different agencies that we work with. And we've really, we do a ton of things, or anything you could think of gender policy sits here within the White House, which is very exciting. It's a huge responsibility. It's also a huge opportunity to do work that is incredibly important, certainly to President, the Vice President, my boss, the Director of the Gender Policy Council, Jennifer Klein, and then, all the cabinet officials that we work with on a day-to-day basis. I would sort of organize our work across 3 different verticals. So the first is healthcare. So we do a ton of women's healthcare. We really have led the administration's response to the Supreme Court's decision to overturn Roe versus Wade. So an incredible amount of work that we've been doing to do what we can to defend reproductive rights and protect access to reproductive healthcare at the federal level. A lot of that work sits right here with the Gender Policy Council. We're also working closely with our colleagues in the First Lady's office. Joy, this is what you're mentioning. It's a very exciting new effort that I might go into to save some details for later, but a very new White House initiative on women's health research. I think we recognize the huge disparities and gaps we have both in funding and attention on investing in research on women's health. And I can't think of sort of a better intersection of those gaps at the intersection of maternal and mental health for women. And so I think it's an exciting sort of moment to be talking to you all about that. The president signed a historic executive order on Monday, and we've been making some key announcements. So maybe I'll hold off on details, but it's a very exciting week for our women's health research portfolio. Maternal health, of course, is in that bucket as well. So we do a ton of work on women's health. But we also really focus on women's economic security. So everything from ensuring that women have access to the good jobs being created by the president's Investing in America agenda, to childcare, to paid family medical leave to sexual harassment in the workplace, all of those types of issues that we know are, and this is a health group, so we could talk about sort of the social determinants of health as well, and making sure women and families have the economic security that they need to live healthy lives is a key focus of the work that we do. And then the third sort of big topic area that we really lead the administration's efforts on is the fight to end gender-based violence. And so the president himself, is the first one to tell you, as a senator 30 years ago, he wrote the Violence Against Women Act and got that passed. And he has been really a champion of ending gender-based violence for his whole career. And I could go on and on about that record, but a lot of that work, again, across the administration, sits right here with the Gender Policy Council. So it's very exciting. There's a ton that we could talk about, and I might turn it back over to you, Joy, but thanks for the opportunity to even kind of explain who we are and some of the work that we're doing.
Yeah, I feel like I have a follow-up question for you, Katie, because it is such an exciting and important portfolio that you're leading at the Gender Policy Council. I did want to flag that the gender-based violence work includes intimate partner violence, which is on top of mind for many folks in our network. Providers struggle, of course, to just screen for maternal depression to begin with, but recognize that there are a lot of factors at play that could be leading to maternal mental health disorders. I just wanted to flag that that's one of the items that's being looked at under that portfolio. Katie, if I could stick with you for just a minute longer, we also know that there's a tie to maternal mental health when there's lack of affordable childcare access, and also paid family leave. It came up actually today on a prior panel about Black women in particular in Ohio and Cleveland, a program that said, women couldn't take off time for work for their own care to go to their OB. So now they're looking to embed OB midwifery care for postpartum follow-up in pediatric settings so that moms are at least getting care there because they're already bringing their children. So just another example of how paid leave really matters in the postpartum period. Also, there's been some effort around extending paid leave to women in pregnancy to take time off work for prenatal care. But I would love for you to talk just a little bit about your perspectives on childcare, paid leave, anything else you want to share on the social policies. Yeah.
No, I mean, I think you laid it out beautifully. All of these things are so interconnected. And when we are, putting in policies in place to support women and families and children to help, I mean, it's everything from the child care tax credit to, expanded postpartum Medicaid coverage to childcare to paid family. So to us, all of these things have to work in concert. And it's why, especially in our women's economic security portfolio, we are pushing for all those things as hard as we can. So a lot of it is, if you take childcare as an example, you can see the president calling for additional investments in childcare. Well, I should step back. The American Rescue Plan, which was historic legislation that the president signed, was a huge investment in the childcare sort of ecosystem and landscape. I know no one wants to think back, but if you think back to how disruptive it was to childcare and all the concern, I don't have to tell this group of participants what that was like, but we helped stabilize more than 220,000 children to get the care that they needed. We helped keep childcare providers, 90% of whom are women in that workforce, also, by the way, employed and taking care. And we have seen sort of boons around it, which means we have sort of record high women's labor force participation. We have more moms in the workforce than before. All of these sort of structural supports are incredibly important to us. I think those funds have expired now under the American Rescue Plan. And so, the president called on Congress to restore that in emergency funding last year. The fiscal year 25 budget was released. I guess that was last week. Time is a void at this point, but really calling for the comprehensive childcare, the long-term solutions that we need here. I think when we know very clearly here, when you support moms and families, you're supporting the entire economy and everything we need to do. And then in addition to all that work with Congress, of course, the president last year signed the most comprehensive executive order on care, and not just childcare, also dependent care, elder care, really trying to look across all the different structures and systems that we have. And so the administration has been very busy implementing that. So we're sort of firing on all cylinders on childcare, but really continuing to work with Congress to get those investments. It's almost like infrastructure that we need to have healthy, happy families and a economy that works for everyone. So thank you. It was like the perfect tee up. Could go on and on about that. And it is very much related to maternal mental health, as you said, but really appreciate the question.
It's great. And I think your framing around infrastructure is spot on, right? We have infrastructure for roads and libraries and post offices, yet we don't have infrastructure for healthcare, for childcare, for paid leave. And we know this is important to employers too, right? To support their working, their employees and working families as well. So appreciate that. Speaking of infrastructure and perhaps lack thereof in obstetric care, I wanted to turn to you. We heard on a panel earlier today, just before this panel, actually, from the Purchaser Business Group on Health, who represents large employers, including Walmart, who is very concerned about the fact that OBGYNs don't exist at all. No midwives, no OBGYNs in various rural settings. Elizabeth didn't mention the lack of hospitals, but we know maternity care hospitals. These deserts are really a challenge. So that we're not so depressed about that fact, we won't harp on that or stay there too long, because Diana, you point out often that so much health can happen outside of the healthcare system too. And I'd love to turn it over to you as an OBGYN to tell us more about how you think about holistic maternity care and women's health overall.
Yes, no, thank you for that question. One of my key messages as Surgeon General for California is reminding folks that 80% of healthcare happens outside of the healthcare setting. And so what do I mean? Well, if you're fortunate enough to have a 15-minute medical visit, prenatal visit, postpartum visit with your healthcare provider, that recommendation, the prescription is not going to really make the big change that needs to happen, because you're going to go back to the environment where perhaps there are challenges with transportation, with food, with being able to work, being able to care for yourself or your family. Life gets in the way if there are poor living conditions, access to water. I mean, it goes on. So really critically important as an OBGYN, I'm trying to help the health team realize that we need to really partner with everyone outside of our healthcare setting. We need to partner with communities. We need to partner with organizations such as not only community health workers, doulas, with schools, with faith-based organizations. I heard somebody say earlier, the beauty salons, the nail salons. Meet people where people are. Healthcare should be everywhere, and it should be a paradigm shift as to how we are looking at our health. If we all do our little piece in promoting positive, healthy behaviors, wow, imagine what would be around us, a healthier community. And I totally respect that not everyone has access to the same roads, to the same sidewalks, to be able to walk. But there are many ways that we can address those challenges by perhaps doing some virtual walking together, from your home, or doing drop off, walking around on the schoolyard to try and get those extra steps or the healthy foods. I'm hearing of different models where hospitals will have farmers markets to be able to access fresh fruits and vegetables. So, but just thinking creatively and going to your 4 pillars, Joy, of providers, payers, policymaker, and partners, really looking at all of that and realizing that we're not going to achieve the health that we want, the outcomes that we want working alone. We have to do it in a cross-collaborative fashion. And by braiding all of the resources that we all have access to, that's how we're going to be able to really push us to the next level of really health everywhere, that whole person care, to be able to not only have that one person that is in front of the healthcare provider healthier, but really for the entire community to move towards that healthier trajectory.
Thank you, Diana. I know you're in an audience that very much appreciates what you're saying and agrees and is ready to roll up their sleeves to make some of those things happen. I appreciate you lifting that up. And Katie, I'll turn it back to you now to talk a little bit about, let's talk more about the research initiative. There's several arms to it. I keep saying the race, but I think it's the sprint for women's health. But all that to say, there's work underway to make this work happen quickly. And I'd like to start by just acknowledging, I think what we are hearing over and over again in the space around maternal mental health is that it may not necessarily, I think some research might disagree with me, but it may not necessarily mean that we need more research around what works. We know what works. It's really around implementation and implementation science. And I also would share, we still diagnose mental illness from a piece of paper that people check boxes off on. And that seems very much sort of lacking. And we know there's a lot of interest in bringing mental health diagnostics to the 21st century, right? So would flag those as opportunities, and we invite our audience, if you have ideas about ways that we should be thinking about maternal mental health research in different ways, to drop those thoughts in the app, and Katie will make sure we share those with you. But Katie, what else should we know about the sprint? What's happening? What was announced this week versus the week before? I think it was or the month before, but a lot of exciting times happening, it seems.
No, thank you. And I do want those ideas. So please, you all should have them. And then please be our guide in terms of what we should be looking into here. So stepping back a little bit, this new White House initiative on women's health research was created by President Biden in November of 2023. So we are moving incredibly quickly, especially for the federal government over here, but we're very excited and there's a lot of urgency. That urgency is being driven, I would say, by the president and First Lady. So this is an initiative that she feels deeply, deeply connected to and very strong about. She's been traveling the country to different research labs. She was in Los Angeles touring a high-tech sort of cutting-edge innovation lab on women's heart health, for example. She was in Illinois talking to researchers on menopause. She was at Morehouse School of Medicine speaking about women's heart health. This is an incredibly huge priority, I think, at the highest level. So that is why we are sort of pushing and running and doing the sprint, as you said, Joy. So there are a couple different pieces to what we've been working on. I might start with this announcement from IRPA-H, which is one of the, I think, our newest health agency here at the administration, which is focused on driving healthcare innovation and research. It was modeled after, some Department of Defense programs that were able to really bring new innovation out to the market and to really benefit society. And so what ARPA-H has done as part of this initiative that we have here at the White House is commit $100 million dedicated to women's health research right now. And so they have sort of they call it a request for solutions. It's out. Everyone here should have it, should look at it. If there are ideas, this is the moment we should be funded. And their model is very interesting. It's they are able to take on even riskier proposals than other people would in terms of funding. And so this is a little bit of a moonshot option. And so folks should really look at this. And Joy, I can't tell you how much I appreciate what you said about translational science and research. And you can see that that's reflected in the executive order and the creation that we know so much. We're not doing research for the sake of research. We are doing research to connect it to physicians like Dr. Ramos in clinics, outside of clinics, as we just discussed, but we really want to make sure the benefits of the research that we're doing reach women. I would say we have that big ARPA-H announcement at the State of the Union address. The president called for a bold, transformative investment of a new $12 billion in women's health research, which would be truly historic. And I could talk a little bit more about what that were, but we have some great ideas of the kind of work we want the National Institutes of Health to be doing. And then fast forward to Monday, the president signed an executive order on women's health research. And we had, I think, more than 20 agency announcements and commitments alongside that. So it was the most comprehensive executive order that any president has ever signed on this topic. And then Maria Shriver, who was on stage, who many of you might know on the California connection, I think she made a joke that it's probably the first time that menopause has ever been in an executive order that the president has signed, which is the case. So we're very excited. There's a lot of work to do. I know that was a very high level. We would love to get out all the materials, but do really hope this group, if you have research ideas, if you have innovation ideas, we definitely want them and want to have a focus certainly on maternal mental health, of course. So
That's
sorry to
great.
filibuster, Joy. There's a lot. We're very excited.
Yeah, I know people are very excited about this, and I'll speak on behalf of all of us. It's all about access in this space, access and improved diagnostics, I would say. But Katie, we'll be here right by your side to share ideas and brainstorm, and happy to convene leaders, including researchers in our space. Thank you, Katie. Very exciting. And the race, the sprint, whatever it is, it's on, and we're all a part of it, which is quite exciting. And it is exciting to hear that menopause, perhaps is put in an executive order for the very first time. We have arrived, I suppose, as women, right? Dr. Ramos, I'm going to turn it back to you. And I do want to spend just a little bit more time talking about adverse childhood experiences. And we've acknowledged in our 2 days together here that they're very much bi-directional, right? So if we don't diagnose and treat and support women early on with interventions that are effective, that maternal mental health disorder can actually serve as an ACE in children. And those who have experienced ACEs themselves have a higher risk, of course, for maternal mental health disorders. So your predecessor was a pediatrician, and so wanted to focus on screening for ACEs and detecting ACEs in the pediatric setting. You're an obstetrician, which we're thrilled about, and we love pediatricians too, but really excited to hear about how you're thinking about moving this up, I think upstream, right? To talk about mothers and screening and supporting identification and resources for mothers who may be screening positive for ACEs. Thoughts on this and policy solutions?
Yeah, so, as an obstetrician gynecologist, when I learned about ACEs, so addressing ACEs is codified in the statute into the position. So I wanted to understand, how can I really leverage this as an obstetrician gynecologist in training, an adult provider? And I realized that ACEs study research started in adults. It started in a lot of women. And the over 15,000 patients that Dr. Vincent Belletti at Kaiser San Diego researched, they were in an obesity clinic. And it was the fact that the patients would lose the weight, gain the weight, and then finally tried to understand what was happening, that the realization came to light that, wow, it was what was happening in childhood that really was really put people on a negative health trajectory. And so there has been a lot of work done here in California in terms of reimbursement. California is the first state to provide reimbursement to Medicaid providers, Medicare providers for screening for ACEs. They are developing model networks of care. What do you do once you diagnose somebody? Where can they get help? That is all part of it. The governor has a precision medicine work group, and precision medicine has funded not only ACEs, but mental health. How do we come up with novel ideas on addressing these both critically important topics? So California is very invested, not only in addressing ACEs, but coming up with solutions that will help, like you said, Joy, address the upstream opportunities. And when we do this all together, then we can all thrive to a healthier trajectory, a healthier community. And so I'm just excited that I'm part of this group that is helping lead and making folks realize, wow, this is a 2-for-1. This is a 2-for-1. When you help a mom, it's even more. You're not only helping the mom, you're helping that baby, you're helping the entire family. And I was at a meeting for the Federation of International OBGYN meeting in France, and I heard a lecturer from the UK highlight that. And I realized, okay, I had to come across the pond in order to get my theory validated that by investing in the mom, you really are investing in the family and really the whole community.
We are the foundation, right? Mothers are the foundation of our nation. With that, I thank you both, and we want to continue the conversation and follow your work. We'll be reporting through our blog posts and others for the field what's happening in both of your spaces. So I appreciate your time very much today on behalf of our whole network. Thank you for your leadership and all that you do.